How do liver function tests explain dark urine in pancreatic cancer? Dark urine can be a concerning symptom, especially in the context of pancreatic cancer. One of the main reasons for dark urine in this condition is jaundice, which occurs when there's an increase in bilirubin levels in the blood. Liver function tests, often referred to as LFTs, play a crucial role in understanding this situation. They measure various substances that indicate how well the liver and bile ducts are functioning, including bilirubin, alkaline phosphatase, and liver enzymes. In pancreatic cancer, particularly when tumors form in the head of the pancreas, they can block the common bile duct. This duct is responsible for transporting bile, which contains bilirubin, from the liver and gallbladder into the small intestine. When the bile duct is obstructed, bile cannot flow as it should. This blockage leads to a buildup of bilirubin in the bloodstream, a condition known as cholestasis. As bilirubin levels rise, it causes jaundice, which is characterized by yellowing of the skin and eyes, along with dark urine. The dark color of the urine arises because excess conjugated bilirubin is filtered out by the kidneys and excreted, resulting in a brown or tea-like appearance instead of the usual pale yellow. Liver function tests are essential in this scenario. They measure total and direct bilirubin levels. When these levels are elevated, it indicates that there is an issue with bile flow or liver function. In cases of pancreatic cancer with bile duct obstruction, direct bilirubin levels are typically high. This is because the conjugated bilirubin cannot reach the intestine and instead accumulates in the blood. Another component of liver function tests is alkaline phosphatase, an enzyme that becomes elevated when there is a bile duct obstruction or cholestasis. Additionally, liver enzymes like alanine aminotransferase and aspartate aminotransferase may show mild elevation due to stress on liver cells, but they are less specific for diagnosing obstruction. In clinical practice, patients with pancreatic cancer often present with painless jaundice, dark urine, pale stools, and itching. The dark urine serves as an early visible sign of bilirubin accumulation. When liver function tests reveal elevated direct bilirubin and cholestatic enzyme patterns, it supports the diagnosis of pancreatic cancer and helps differentiate it from other causes of jaundice. To summarize, the mechanism behind dark urine in pancreatic cancer involves the obstruction of the common bile duct by a tumor. This blockage prevents bile flow, leading to bilirubin accumulation in the blood. Elevated conjugated bilirubin then spills into the urine, causing it to darken. Liver function tests are vital in detecting this obstruction and confirming the presence of jaundice related to pancreatic cancer. These tests not only aid in diagnosis but also guide further evaluation and treatment options. Always consult with healthcare professionals for personalized medical advice regarding symptoms and conditions.